Hi everyone, Dr. Hall. We're going to finish out our second lecture on abortion, looking at some potential approaches to policies around this issue. So we're going to talk about methods or strategies that we think might be effective at preventing or reducing the number of abortions. So as we kind of wade through the controversy, if we decide that reducing abortion rate is a goal worth pursuing, and so we're going to take as a premise today that a lot of people in our society would be happy to see the numbers of abortion decrease, not saying that the majority of people would want them to never happen or to never be available, but if we decrease the number of abortions, that might be a goal worth pursuing. So does making it illegal help toward that goal? And if not, what could? So let's take a look. So here's the problem in a nutshell, right? First of all, we have people who don't want to get pregnant who end up getting pregnant, right? That happens for a variety of reasons. Some of these people are using birth control but had trouble taking it regularly, and a lot of these people were not using birth control, either because they didn't think they were at risk or because they were concerned about the risks to them of contraceptive methods themselves. Once you are pregnant, you have three basic options. You can choose to continue the pregnancy and raise the child yourself. You can continue the pregnancy and choose adoption for the child, or you can choose abortion. So as we think about all those different lines, right? Every line here is a process on which we might be able to perhaps have some influence. So first of all, can we disincentivize abortion? And I'm going to start with this one because this is kind of the most straightforward potential strategy, and it's the one that gets the most attention, and it's the one that people try to do the most, right? So can we just make it so that it's difficult for people to get abortions or impossible for people to get them? So currently, there's already a lot of shame and stigma associated with abortion. We know that. It is very vocally opposed by many religious groups and political leaders and billboards. There's no shortage of social messaging out there to disincentivize abortion. It also is relatively expensive for most of the people who need it anyway, or who choose it, and not very accessible. So already we are doing a lot of things currently that disincentivize abortion already. So would making it illegal perhaps decrease the numbers of people who choose abortion? And that's a really good question. So the best data that we have is a study from 2016 done by Lancet, which is one of the largest medical journals out there. And they looked at abortion rates around the world by country, looking at whether abortion was legal or illegal in their country. And so what they found actually is that in countries where abortion is illegal, the rate of abortions is higher. Now you might say 37 versus 34 out of 1,000 women per year. That's not a huge difference, but it was statistically significant. So that should give us pause, right? We do not have any examples of a society where abortion is illegal, where it has seemed to effectively decrease the abortion rate. Now, true disclosure here on this data is that it's tricky. And the reason why it's tricky and hard to interpret this data is that oftentimes those same countries, as those of you who have looked at the story on Pakistan will know, those same countries don't have easy access to contraception. So what we don't have on this planet currently is a country that has comprehensive sex ed, accessible and available birth control, but illegal abortion. That is a combination that does not exist. It is a combination that might be effective in decreasing the abortion rate, but we have no examples of societies like that in our world. So it tends to be if we're a society that really shames sexuality and sexual activity, that both birth control and abortion are outlawed, right? So those two things, birth control and abortion, tend to go together in terms of whether we allow for them or we try to squelch them. So it's really hard to know whether making abortion illegal is effective or not in reducing the abortion rate. What we do know is that when it's illegal, people who don't want to be pregnant and who don't want to have a child, as we saw in that documentary, they will often do anything in their power, even risking their own lives, to end that pregnancy. And so unfortunately, we do see very high rates of maternal deaths due to self-induced abortions or going to unlicensed, unregulated practitioners when abortion is criminalized. So there's a huge risk here to take in a strategy that we do not know for sure whether or not it would be effective in actually decreasing the abortion rate. So perhaps what we want to do instead of trying to criminalize abortion, perhaps maybe could we back up and have an impact on something much earlier in that process? So how do we prevent people who don't want to get pregnant from getting pregnant? And so as we've seen, abstinence-only programs and encouraging abstinence, although abstinence is an excellent choice for many people, and I fully support that, it is not reasonable for us to expect that abstinence is going to be the choice that will work for everyone. In fact, statistically, we know it won't work for most people. It works for some, which is great, but not for most. And so we need to be really upfront with people about ways to then protect. So we need to be really upfront with people about ways to protect themselves from pregnancy. So comprehensive sex education that teaches people about how pregnancy occurs, how to prevent it, how to use a condom, how to take birth control pills, how they work, what exactly are the risks, what is an implant, what is an IUD, how do those work, what are the pros and cons of Depo-Provera, all of these things. The more people know, the better informed they are, hopefully the better decisions that they can make to protect themselves and their partners. There's also really good data to support that if you make it easy to get birth control, not only make sure people are educated about what it is and how it works and the pros and cons, but then make it easy for people to get it, that is really helpful too. And so there are actually some states that are looking at trying to make some forms of birth control available over the counter. So of course condoms already are over the counter, but even things like birth control pills, which as you know do have some medical risks, but are not riskier than some of the other things that are sold over the counter. So people are looking at what are ways that we can make it easier for people to get birth control. In most of Europe, birth control is sold over the counter, for example. And then of course, anything we can do to improve insurance coverage and decrease copays so that birth control is covered, that, as we've already seen, makes a huge difference. I think another important part of this is public support and messaging around birth control. We tend to do a lot that shames people for being sexually active, which is weird because then we also celebrate people who are very sexual. We have this very strange kind of duality in our society. But being more clear and open about, hey, if you are sexually active, how are you protecting yourself or your partner from pregnancy if that's one of your risks, right? So instead of kind of treating someone who's buying condoms as, you know, you're a slut, you're a whore, you're a horrible person, right? Maybe we should be supporting that with our public health campaigns or messaging or our billboards about being responsible and taking measures to prevent an unintentional pregnancy. What about if an unintended pregnancy occurs anyway? So either because our previous measures that we discussed failed and they didn't use birth control, or as we've seen, sometimes even if you are using birth control correctly, you can still get pregnant, right? So even with an IUD, you can still get pregnant. It's very rare, but it does happen. I've seen it happen, and certainly it's in the data. So if somebody has an unintended pregnancy, how do we support those two other alternatives to abortion, right? How do we think about supporting people in choosing adoption or in choosing to raise the child themselves? So for adoption, if we look at the current data, about 135,000 children are adopted in the United States each year. More than half are from the foster system. And that number is probably increasing as the number of youth in our foster care system are also increasing due to family distress from meth and opioids, and also rising inequality. About 26% are international adoptions, and about 15% of adoptions in the United States are infants whose parent says, yes, I'm going to choose adoption for this child. So it ends up being only about 20,000 a year out of over 1 million unplanned pregnancies. So there's potentially some room here to perhaps increase the numbers of people who might end up opting for adoption as their choice. So if we think about how do we make adoption a more attractive option for people, right? How do we support people in choosing adoption as opposed to an abortion, for example? So one of the ways to do that, obviously, is to provide the health care, their obstetrical care, their pregnancy-related care, and other support for the pregnant person. Many adoption agencies currently do this. Also, many states have health care programs where if you are pregnant, your health care is covered. It is covered by the state. You automatically get put on the state Medicaid, which in Wisconsin is Badger Care. So most states have that, including Wisconsin. If you are pregnant, your health care gets covered. You have to apply and get on the program, but your health care will be covered for the duration of that pregnancy and childbirth. So that's really important for people to know. But some adoption agencies will also provide some support for rent or food or other things to help ensure that the person is going to be healthy throughout that pregnancy and be able to meet their own health and nutrition needs. The other thing, and a lot of students have talked with me about how expensive it is to try to become an adoptive parent, right? To adopt a child. There are a lot of financial barriers, and there are other barriers in terms of paperwork and proving that you're a good household and that you're not going to abuse the child, and that's all very important. But the financial barriers are quite significant. I think the average couple spends more than $10,000 in the process of trying to adopt a child. So that's a really high bar for a lot of families. So can we think about ways to reduce that burden potentially? And so if we're going to do that, we have to examine how we fund the adoption process, because right now, primarily it's funded by the adoptive parents, right, who are paying the adoption agency. And maybe we need to look into some governmental funding or other social funding. Certainly there are religious-based adoption agencies that are kind of funded through their religious organization, but so maybe we need to look at how we fund that. But I think just as importantly, we need to really think about the stigma that we place on pregnant people who choose adoption for their baby. And I've tried to be really intentional in the language that I use, because the traditional phrase is, she gave up her baby for adoption. Just think about that phrase for a minute, she gave up her baby. And there's a lot of judgment in there, and there are a lot of negative connotations in there. We tend to, very much in our society, expect that there is no higher calling for a woman, there is no more noble calling than to become a mother, and that every woman should be thrilled and honored to become a mother at any time that she finds herself pregnant. And while for some people that is true, there are lots of people for whom that is not true. And yet we still have a lot of cultural expectations that women should be nothing but delighted to become mothers. And I think we need to consider doing a better job appreciating that different people are different in terms of what's important and what's gratifying for them, and also that those things can change over their lifetime as a result of their circumstances. And maybe think about supporting people who choose adoption and saying, wow, what a wonderful gift you are giving to that family, or what an amazing gift you're giving to that family and that child who's going to be raised by a family who is going to be so thrilled to have them and love them so much, right? How do we change that narrative so that we aren't being judgmental of people who choose abortion and making them feel badly for choosing abortion? Because I think that is one of the biggest hurdles that people face, along with, and I think we need to acknowledge, going through a pregnancy is medically dangerous and can be very emotional, and then choosing to not raise that child, right? So as Rosalie from the documentary talked about, being pregnant with that child, giving birth to it, and then not and then, she talked about giving it away to strangers, that was really emotionally difficult. So how do we also support people who choose adoption in terms of preparing them for that process and supporting them through that? I think that's also really important. So the other alternative, of course, is to raise the child yourself. And we've seen many of the barriers that people face, primarily financial, right? So people who are barely making it by cannot, in our society, afford to raise a child because we don't provide universal child care so that they can still go to work. We don't give any financial assistance other than a $1,000 tax credit per year. That's it. And it costs a lot more than $1,000 to take care of a child over the course of a year. So maybe we need to think about financially supporting parents. Maybe we need to think about all of the work and effort and resources in terms of time, emotion, and money, right? Lots of financial resources that are necessary for parenting. There are many countries that do this. You get stipends to help pay for what your child needs. In fact, in some Scandinavian countries, you get a box that is filled with diapers and clothes and bottles, and then the box itself, it's this special cardboard box, serves as a bassinet, and there's like baby blankets in there, and like every single person, regardless of their financial station, every single person gets this box. It's full of baby stuff, right? So what an interesting idea. Maybe we need to think about, how do we support parenthood, right? Childcare support. As we talked about, if every dollar you make at your job is going to end up paying for daycare, then what is the point, right? And you need that money to pay the rent. And so, do we need to look at providing publicly funded childcare and daycare, including not only for infants and toddlers, but maybe even before school and after school care also. I was horrified when we first moved here, and my job goes till 5 o'clock. I was working primarily at the clinic when we first moved here, but my son got out of school at 3. And I said, well, what's the after school program? And they said, there is no after school program. Right? Like, I was horrified. Well, what am I supposed to do, right? Luckily, I have financial means. We were able to hire stout students to babysit our child for 2 hours until we could get home every day. But that is not an insignificant cost, right? So how do we support people in doing the right thing by their families if they want to be parents? How do we help mothers return to work after childbirth, right? When do we require them to come back to work after childbirth? Some people quit their jobs entirely because although they may have some maternity leave, they're not ready to return yet when that maternity leave is up. And so they just quit because there's no other option. There are other countries in the world, especially European countries, where it's typical to get 6 months or a year of maternity leave where you are paid. So you actually receive anywhere from 60% to 100% of your typical salary for up to 1 year to care for your child after they are born, right? Maybe we need to think about these things. And I know they're expensive, but if then we have somebody who then returns to the workforce and is paying taxes versus someone who doesn't and then is not paying taxes, right? Some of these things can pay for themselves. We also need to think about flexible work arrangements, either working from home, which is challenging in and of itself, let me tell you, or reduced hours, right? So the ability to maybe work a 30-hour week, for example, or other things like that that are friendlier for parents. And finally, we need to think about societal support for single parenthood. And this comes to kind of this shame and stigma. You know, we tend to look down on people who have babies out of wedlock, right? Because that is not our cultural ideal. But maybe we need to stop shaming people and instead support them in having the healthiest family they can. So lots of ideas to consider in terms of ways that we might work to decrease the number of abortions that occur in our country. So if we want to reduce abortions, we need to reduce unplanned pregnancies. And so we've talked about some of the ways that we've done that. We need to support people who choose to parent and raise the child. And we do a terrible job of that actually right now in our country. There's a huge financial penalty in this country for having children. So maybe we can look at that. And we need to support adoption as well. And I think as much in terms of how we talk about it and the messaging that we give as much as anything else. And so we need to keep in mind that making abortion illegal, although it is the primary objective of many groups that want to see a decrease of abortions in this country, although making it illegal is their prime objective, it may not work. And there's really good evidence that it may cause excess harm. So next time you're sitting around the Thanksgiving dinner table, or having conversations with your friends late at night over a few drinks, or whatever it might be once we're done with social distancing, hopefully now you've kind of thought a little bit more broadly about what some potential strategies might be if we had the goal of reducing the abortion rate in our country, and also what are some policies that might do a good job of making us all a little bit happier and healthier. All right, so that's it for abortion. Next week, we're going to start talking about infections.